The learning objectives of this module are to know the indications for surfactant therapy and to learn how to provide exogenous surfactant replacement therapy. Indications for exogenous surfactant replacement therapy includes infants who have surfactant deficiency, such as preterm infants with respiratory distress syndrome, or surfactant inactivation, such as infants with meconium aspiration syndrome. Surfactant may be given as either prophylactic or as rescue treatment and is delivered via the intratracheal route. Prior to administration, it is important to ensure proper placement and patency of the endotracheal tube. Transient adverse effects of surfactant administration may include bradycardia, oxygen desaturation, and hypotension. Therefore, it should only be administered by those who are trained and experienced in the care, resuscitation, and stabilization of neonates. There are several different ways to deliver surfactant replacement therapy to a neonate. In the first section of this module, we will review the equipment currently being used in one of our NICUs for surfactant replacement therapy and then demonstrate a technique to deliver surfactant to an intubated mannequin. In the second section, we will demonstrate surfactant administration to a 27-week preterm male infant with surfactant deficiency secondary to respiratory distress syndrome. Remember to always follow your own institution's guidelines when providing surfactant replacement therapy.
In this video, we are going to demonstrate surfactant administration through a catheter. Here at our institution, we use a catheter kit shown here. The catheter kit comes with a 5 French catheter to administer the surfactant through. It also comes with 3 different size adapters for the appropriate size ET tube that you will be using. A 2.5, a 3.0, and a 3.5. For the proper setup, we have a 3.0 ET tube, if we were using that on the baby that we will be giving surfactant. What we do is we remove the stock adapter from the ET tube, like so. You then get the appropriate size surfactant adapter, which is the 3.0. You put that where your original adapter was, and then we have the setup here where we have one port for our catheter, this one in front of my finger, and the other port would be for your manual bag or your ventilator circuit. So from here, we take our 5 French catheter, we remove the blue cap, and this catheter goes in the smaller of the 2 ports, which goes like that. And now you are ready to administer your surfactant. So we have the stock or the adapter that comes with the ET tube currently in place. So what we will do is we will disconnect the bag. We will remove that adapter. We will take the 3.0 adapter that comes in the kit. We will place that in the 3.0 endotracheal tube. Then we will take our catheter, remove the blue cap, putting that end in the smaller port, and then reconnecting our bag to the larger port. And at this point we can resume manual ventilation, like so. So the next step is inserting the catheter to proper placement, administering the surfactant, and removing the catheter, making sure our patient is stable through the process. So here we have to properly measure the correct depth of the catheter in the ET tube and then administer the surfactant. So here, for the purpose of the video, I will focus on inserting the catheter. You can pretend we are still manually ventilating the baby through the whole procedure. Here we take the catheter, stabilizing the ET tube. So here we will insert the catheter, matching up the markings on the endotracheal tube to the proper markings on the catheter. I will be matching up the 14 on the endotracheal tube. I will be looking for the 14 on the catheter, which will be telling me that I am at the end of the endotracheal tube. And that looks like this. I will be inserting this through the endotracheal tube, down the endotracheal tube, until my markings match up. So I have the 14 at the 14, and then you can advance about a ½ centimeter beyond that, ensuring that you are just that distance beyond the endotracheal tube prior to administering the surfactant. From there, we will then take our aliquot, or our dose of surfactant. We will administer that over a period of a few seconds, ensuring that the surfactant does not come back up the tube, and if it does, we will just continue to bag the patient through that procedure. And as you finish administering the dose of surfactant, remove the catheter and then resume normal bagging. That's the demonstration of inserting the catheter, and we can also demonstrate giving both aliquots, listing the baby to the right and to the left. Okay, so here we have the baby listed to the right side, on his right side or her right side. We are about to give the first aliquot. Prior to administration of the first aliquot, things to consider: making sure the baby is stable, vital signs, saturation, heart rate. Also, after intubation, listen for bilateral breath sounds, making sure the tube is in proper placement as well. So prior to administration, bag at a normal rate. Prior to administration of the surfactant, and then after, we might bag at a little faster pace. So prior, here we're bagging at a normal rate, the baby is stable, we are listed to the right side, and we're ready to administer our first of the 2 aliquots. So here, I will begin advancing my catheter. Like mentioned before, we will be matching our numbers up on the catheter to the ET tube. So I will be matching up our 14 and 14 on the ET tube, advancing at about a ½ centimeter beyond that, and now administering the surfactant. I'll depress the syringe, administering the surfactant at you want to take around 15 to 30 seconds if possible to administer the full first aliquot. When you are done administering your first aliquot, remove the catheter like so, and then begin your bagging again at around 40 to 60 breaths per minute. During the administration of the surfactant, you might get some of the surfactant coming back up the tube. That's when you want to continue bagging the patient through the procedure in a way making sure that that surfactant stays going down the tube, not up the tube. So after removal of the catheter, like mentioned before, we want to bag at around a rate of 40 to 60 breaths per minute. And while on the right side here, we would want to bag between 1 to 2 minutes, making sure our vital signs are stable. And as we come to the end of our 1 to 2 minutes, and we have no remaining surfactant in the ET tube and our vital signs are stable, we will then return the baby back to his or her back or neutral position. Things to consider: while surfactant is being administered, like I said, the vital signs, and also after administration, try to wait minimally 1 hour.
Can you give me a little cry pad?
Yep. How far do we want to be down?
Put them in just 7. Go ahead.
I'm just putting the adapter on. And you can continue bagging. Where is the... Then we... Now we're putting the multi-access catheter on. Let me just listen, make sure I didn't do that.
I mean, I could probably put this up now.
Should just take a couple of minutes. It shouldn't be too long. You're bagging with 25/5. Nice job.
Right. Yep. So we're gonna go down.
Just
and,
keep bagging through the whole time?
Yep. When I actually do it, I'll grab the bag because I'm going to keep it up. Now, let's see how we go. Okay, here goes the half a dose. Just grab it. Sometimes it backs up there. We'll probably run this around, but
Yeah.
old eyes just don't work like they used to. I'm just going to take this off. Yeah, there we go. You ready? It's on the side, right?
Yeah. They really like the surfactants. That's great.
Here we are. Now, just going to put up, looks good. For bigger kids, it comes right back up. And fine. I'll do this for about a minute. Huh. Nice response.
Yeah, that's excellent. Yeah.